Hello again. When various right on and liberal trade unions start moaning about the number of immigrants coming over here and taking jobs which might otherwise be occupied by British people, you know things have got pretty bad. The director of the Royal College of Nursing, for instance, says that the government must do more to reduce the disproportionate reliance on internationally trained recruits in the health service. Yeah, that's one way of putting it. I cannot recall offhand when last I was treated or seen by a white British doctor. Whether at hospitals or the local health centre, it is all foreigners now. I think we all know this. It's not just the case in inner city areas of London and Manchester either. The Princess Alexandra Hospital in the Essex town of Harlow seems also to have only foreigners working there as doctors. My personal impression in recent years has been that this trend is accelerating, let's say becoming even more pronounced, but perhaps it's different in other parts of the country. Apparently not, for new figures have just been released by NHS Digital, which reveal the true scale of the situation. And frankly, it's shocking. A third of the doctors and nurses recruited by the National Health Service last year came from overseas. This has brought us to a position where there are now in this country no fewer than 8,776 doctors from Egypt and even 3,917 from Sudan. Don't even mention the more than 30,000 Indians or 10,000 Nigerians. Something is seriously amiss, and it seems that it's not just my imagination. Last year, 40% of new nurses who joined the NHS trained abroad. In 2015, it was just 25%. And a third of doctors come from abroad as well. Why is it a problem if we have so many doctors and nurses? There are two problems. In the first place, I'm confident about standards in British medical schools, and I know that a doctor or nurse trained in this country are going to be well trained and know their profession. I do not know the same about Sudan or Romania. I mention Romania because, of course, we have 3,408 doctors from Romania currently working in Britain. The second difficulty, of course, is language and culture. Many of the new recruits do not speak and understand English sufficiently to know what patients are telling them. Most have a basic knowledge of English, but they don't speak it so fluently they will know what a patient is actually saying, particularly if the patient has, say, a northern accent or uses colloquialisms. This is particularly important with so many consultations now being conducted by telephone rather than face to face. It can be a two-way problem as well because a lot of these people have very thick accents and patients don't understand them either. The last time I spoke to a doctor in a hospital, I had to get her to repeat what she was saying several times because she had such a thick African accent that I simply couldn't understand what she was saying. This is likely to get a damn sight worse in the next year or two because the NHS is currently short of 12,000 hospital doctors and more than 50,000 nurses and midwives. Guess where they'll be coming from? I'll give you a hint. It won't be this country. All this, of course, ties in with the wider question of immigration, because if you have hundreds of thousands of new patients signing up to the NHS each year, as is the case because of immigration to this country, then all those people will need doctors, nurses, and midwives. The answer will, of course, be to increase immigration, but I'm not sure that this is the wisest strategy. In the description to this video, I give a link to one newspaper article about this subject. There are many from other newspapers, so I dare say some viewers have already spotted this on the news this morning.